I think there are a lot of misconceptions about orthodontics. First of all, I think that people think that orthodontics is expensive. And I think that's a misconception that happened because I think 10 or 15 years ago, orthodontics was expensive. But I think today, in today's economy, I think that orthodontics is a terrific value. I really do. I think for the amount of work that an orthodontist does, typically we see a patient for over 2 years, and the changes that one experiences in their self-esteem and their feeling of self-worth and in the health of their mouth, I think today's orthodontics is an extremely good value. So I think that's one of the things that people are concerned about. I think another misconception about orthodontics is discomfort and pain. You know, parents keep telling their kids, and I keep seeing them, oh, wait till you go to the doctor and cranks up the wire. First of all, we never crank up the wire. I don't know where that cranking up the wire came from. We don't do that. 25 years ago, the wires that we used to move teeth were made out of stainless steel. And stainless steel, hey, do you ever feel stainless steel? It's real hard, so it's not soft. So there was a great deal of pressure associated with orthodontics back then. Today we use nickel titanium wires and wires that are high technology wires that are much, much softer. It's almost like rubber. And so the discomfort level is way less today than it was 20 years ago. And then also today we move teeth using elastomerics, plastic or rubber bands, not these sharp springs that they used a long time ago. And of course, today we have Invisalign. So I think that the level of discomfort is much less. The amount of hardware in somebody's mouth is much less today than it was years ago. There was a misconception that you have a whole full mouth of hardware, and you did. 20 years ago, every tooth was wrapped 360 degrees in stainless steel. Today, we simply bond or glue on a tiny little bracket on the front of every tooth. So those misconceptions, forget about it. Today's orthodontics, it looks good. You can have colorful orthodontics if you want. You can have invisible orthodontics as you want. And the forces are so low that the discomfort levels are much less, and there's very rarely anything that's sharp or poking you today.